Millions of Americans lose sleep every night, a lot of them because their partners wake them up snoring. The National Sleep Foundation estimates that some 90 million Americans and about 1 in every 4 couple are affected. But there are a few things you can do, and Dr. Michael McDonald is a surgeon in San Francisco who specializes in helping chronic snorers, and he joins me here tonight. Thanks for coming.
You're welcome.
There are a lot of different things you can do out there, a lot of different procedures. Some of them involve things you have to wear. Some of them are different surgeries. We've come a long way in the last few years, say 5 years. There are new, I don't know if it's inventions or innovations, but ways to try to prevent and reduce snoring.
We sure have. And in the past, we thought that it used to be a big machine that you had to use, which would replace one problem for another problem. That machine's called CPAP.
Right. Those breathing things that go over your face, right?
That's right. Now we have alternatives that are much less invasive, much easier to tolerate, and much more effective.
All right, we'll take a look at a couple of them in just a minute, but first we want to kind of talk about some of the effects of snoring. And I guess it affects maybe a couple of people. If there's somebody in bed with you, it can not only affect the person who snores, but it affects the person next to him too.
I think the thing that comes to mind first is your partner. But well beyond the partner, the effect of snoring on each individual is that it may decrease the sleep efficiency, so that the person who's snoring, even though it doesn't wake them up entirely, they don't sleep as well, so they don't wake up rested in the morning.
Right, and overall it can have some health effects on you, on everybody.
That's correct.
Right. Talk about some of the things that, they talk about snoring having health effects besides the interrupted sleep. Is it the snoring itself that's a health effect, or is the snoring reflective of something else that's going on that could be a health problem?
There's a spectrum of sleep-disordered breathing, of which snoring is one part of the spectrum. It's often associated with the more severe elements of that spectrum, including upper airway respiratory distress, or upper airway obstruction, or otherwise known as obstructive sleep apnea. And it's the obstructive sleep apnea that has the side effects that we commonly are concerned about in terms of health effects: heart disease, congestive heart failure specifically, and as far-reaching as metabolic consequences and immune problems.
So who snores? Is it mostly men, and is it mostly people who are overweight, or is that a misnomer?
As you mentioned earlier, it affects in the range of 90 million people in the United States alone. We believe that 60% of men and 40% of adult women are at least snorers periodically.
So a fair amount of women too are
that's
impacted
correct.
by it. All right, let's go to some of the things that we can do to prevent them. And as we mentioned, there's kind of the older stuff, the CPAP, and some surgical procedures you can have done. But there are new things now too, and you've got a couple of them with you here tonight. One of them is called the pillar system, and I'll try to hold it up. I'm going to start with this. Okay, I'll hold up this guy right here. All right, so if everybody can see this, I'm going to hold this up, see if you can get a good shot. It's a little tiny thing. See that little tiny?
The way I describe it is 2 grains of rice end to end.
Right,
in terms
so
of the size.
it's a little mini pillar.
That's
hence
correct.
the pillar system.
That's correct.
So you put 3 of these, they insert these in, 3 of them kind of in the back of your throat, if you will.
The analogy that I use to allow people to understand it is that when we speak, it's a vibration of the vocal cords that produce sound. When you snore, the sound is produced by vibration of the soft palate in the back of the mouth. These stents act like a collar stay in a shirt collar, or a batten in a sail, or rebar in construction, to dampen the vibration of that soft palate so that it doesn't produce the sound.
And it's not a major surgery, right?
Correct.
It's not something you've got to go in the hospital. Do you go under? Are you all the way under?
Very minor procedure done in the office. Takes about 15 minutes under local anesthesia, so just an injected local anesthetic, similar to going to the dentist's office.
And then once this is in, you don't feel this, right?
That's correct. Once it's in, you can't see it, you can't feel it, you don't know it's there. And I have them placed in myself. I had this procedure done about 5 years ago, and that's why I became such a big advocate.
Wow, and then no more snoring?
Well, my snoring is down. Personally, I'm a home run. I'm down to 0, except if I have a glass of wine.
Really?
And the reason for that is when you drink a glass of wine, you lose all muscle tone, and so you have a little bit more laxity of the tissue, so then you're likely to snore. Beyond that, I have incredible resolution of my snoring, but more importantly for me, I feel more rested.
All right,
I'm
real
getting better
quickly, because
sleep.
I think we're going to run out of time.
Sure.
I want to talk about this little guy. Can I touch this? Is
You sure
this
can.
sterile or somebody's personal thing?
You sure can.
It's like a mouthpiece. It's a little mouth guard here.
So this is an alternative to an actual procedure, and it's something that you can do yourself, and it's something you put in at night, similar to a retainer, that pulls your jaw forward slightly. It's considered it's called a mandibular repositioning device.
The old mandibular.
And it pulls the tongue
Or
forward with
mouthpiece.
it, exactly, so that you don't have airway obstruction, and it decreases the snoring.
All right, very good. So a couple of different things you can do to hopefully reduce
This is
your
known
snoring.
as pure sleep.
Pure sleep. So pillar system and pure sleep. A couple of things if you're thinking about trying to cut your snoring to look into. Dr. McDonald, thanks for coming by tonight.
My
Appreciate
pleasure.
it. Hopefully it'll help some people sleep better.
I hope so
on
too.
both sides of the bed.
Thank you.
All right.